Well, talking about Labour's plans for the NHS, I think we all welcome the idea of something being done. But is this it? Do you work for the NHS? Do you fancy what Wes Streeting has been saying about NHS staff working weekends and evenings? It's part of their pledge to deliver an extra 40,000 appointments a week.
Yes, Wes Streeting also promised to protect whistleblowers and cut the NHS reliance on migrant workers.
Well, political commentator Jack Rowlett joins us now. A very good morning to you, Jack. It's good to hear some plans afoot for the NHS, but I just wonder how these plans are going to go down with NHS staff who already feel very hard worked and underpaid.
Absolutely, and I think that's why it's so important that there's a focus on training new staff as well. And, we've seen some of that with a focus on reduction on the reliance of the migrant workforce. I think it's a good idea. So it's going to involve a focus on, they're called high-intensity theatres, and they're being used in some parts of the NHS at the moment, but not across the board. And they can actually increase the number of surgeries that can be done by up to 4 times by basically making it more efficient. So you have patients being prepped while other patients are being operated on. And yeah, as you say, they're going to be done in evenings and weekends. Now, I think it also comes down to pay as well, and we know that they are going to be paying staff extra to do this work. But I think what's interesting is, it's going to cost £1.1 billion a year, and I don't think it's that realistic that Labour keeps saying that their policy pledges are going to be funded by, cracking down on non-doms or cracking down on tax dodgers. It seems like every Labour policy is going to be funded by that, and I'm just not sure that's realistic. I think also we need to be a bit bolder. It's all well and good saying that they're going to create these 40,000 new appointments and that this is going to speed up surgeries, but actually it's access to other parts of the NHS that people are really struggling with as well, whether that's mental health or, just not being able to get an appointment with your GP. So I think we need to be being much more ambitious and actually looking at wholesale system change, really, of healthcare. Let's look to Australia, for example, where they have tax breaks for private health provisions to encourage people that can afford to pay to do so. And the state doesn't actually run hospitals. Instead, patients can choose where they get their healthcare from, and the government will foot the bill. And that increases choice and it increases competition. So if we look at other healthcare systems around the world that they work with different systems that involve both public and private sector involvement. And I think whilst Labour's plans, these policies do sound good, I'm not sure about the funding proposals, and I think there needs to be a lot more ambition if we're going to solve the crumbling, healthcare crisis that we've got in this country.
I mean, Wes Streeting is certainly very confident. He's saying this plan is so good that the Conservative government did a smash and grab on it.
Yeah, well, I mean, he's going to say that, isn't he? Given he's the Labour Shadow Health Secretary, I think, it is a good idea. It is a good idea, but the funding. We are already seeing that the next government is going to have, enormous financial pressure on it. There isn't much money to spend. Every policy that Labour is coming up with, it's saying it's going to fund by cracking down more on tax dodgers. There are only so many tax dodgers around, and if it was so easy to crack down on them, I'm sure the government would already have done so. So actually, we need to be facing up to the challenge. We have an aging population, we have more pressure on the health service. A really good plan, a really top plan would involve wholesale system change and moving more towards a mixture of private and public sector involvement. And I think only Labour can really do that, because if the Tories tried to do that, they would be accused of, trying to end universal healthcare, of, privatising the NHS. But Labour, as the party of the NHS, they actually have the room to come up with something more ambitious because people trust them on healthcare policy. And I think the fact that they're not doing so is a little disappointing.
Jack, I found it quite interesting, Wes Streeting's comments on migrant workers within the NHS. He says that we've been over-reliant on them and describes it as problematic.
Well, I think, migrant workers do an incredibly important job in the NHS, and I would be reluctant to, cut that or throw that out straight away. But absolutely, we do need to increase the kind of domestic proportion of NHS staff, and that comes through having actual strategy on training and recruitment and pay as well. I think we have taken our eyes off the ball across sort of lots of areas, actually, of domestic training for lots of different sectors. So I'm not sure it's really any reliable system needs a mixture of both. We need to be looking at bringing in people where we need them, but also, training people domestically too. Absolutely.
Jack Rowlett, good to see you this morning. Thank you very much.
Well, let us